Tourniquets are life and limb saving devices. There are a few things as simple as placing a tourniquet that can do so much good for the patient. We have to be really adept at putting these on. And it seems kind of intuitive, seems like it shouldn't be that difficult. But if you're not familiar with your device and you don't have a couple of tips in your head, you can do this wrong. So I just want to review a couple of tips in tourniquet placement that I think are critically important to use these devices to their best benefit. Number one is the optimal location of placing that tourniquet. If you know where the bleed is coming from, you want to put the tourniquet 2 to 3 inches above that area. That's about 5 to 6 centimeters for everybody on the metric system. And remember that when you place these, you don't want to place them over a joint. That is going to harm your ability to provide compression. If you don't know where the exact source of bleeding is, and this happens all the time, both in the pre-hospital setting as well as in the emergency department, then place that tourniquet as high on the limb as you possibly can. That is the best bet to controlling that bleed. Once you localize the bleed, you can always move that tourniquet or place a second tourniquet and then remove the first one. Tip number 2 is about tightening the tourniquet. Most of us work in places with windlass type devices. When you place that tourniquet, you don't want to be turning that windlass 9 or 10 times. You want to use the Velcro strap to tighten down that tourniquet as much as possible. And then you're going to turn the windlass maybe 1 or 2 times to complete that tightening. And you're going to do that until arterial bleeding stops. We often see people who put these on kind of loosely, turn the windlass a bunch of times. You're never going to get proper compression. So tighten that Velcro down first and then turn your windlass 1 to 2 times to provide that additional tightening. As soon as you have that tourniquet in place, make sure to note the exact time that it was put on. You want to know how long the patient has been without arterial flow distal to that tourniquet. That's going to help to advise people on when to take that tourniquet down and allow some flow back to that limb so you don't have limb loss. Finally, and this is probably the most important tip with tourniquets, should have let off with this, is that you have to place the tourniquet in order for it to be useful. For a long time, we thought that tourniquets were going to lead to limb loss. We now know that's not true. So put the tourniquet on as soon as you see that arterial bleeding to get full control of the bleeding and stem the tide of hemorrhagic shock. All right, let's wrap this up. Place the tourniquet when you see arterial bleeding to get control of that hemorrhage. You want to place it 2 to 3 inches or about 5 to 6 centimeters above the exact source of bleeding if you know where that exact source of bleeding is. If not, place it as high on the limb as possible. And when you're tightening it, tighten the Velcro strap first and then turn the windlass after you've tightened that Velcro strap. That's the best way to get control of bleeding.